Hello, I'm Chini from MSK Marai.
In general, secondary signs are highly specific for the presence of an ACL injury but are of limited sensitivity. Overall, primary signs are the most useful for determining the status of the ACL, and the addition of secondary signs are of little added or independent value. In this session, we will briefly review the primary signs used to diagnose an ACL tear, and then discuss the secondary signs. The primary signs used to diagnose an ACL tear are as follows. Focal discontinuity of fibers. Increased intrasubstance signal on fluid-sensitive sequences. Mass-like tissue in the expected location of the ACL without normally oriented fibers. Abnormal orientation or bowing of fibers. Since the ACL's function is to prevent anterior tibial translation in extension, an ACL tear should increase the degree of anterior tibial translation during knee extension, giving rise to anterior tibial translation. Therefore, the secondary signs are the findings related to anterior tibial translation. At the mid-sagittal plane of the lateral femoral condyle, a line is drawn through the most posterior corner of the lateral tibial plateau, and the second line is tangent to the most posterior aspect of the lateral femoral condyle. Anterior tibial translation between 5 and 7 mm is suggestive, and over 7 mm is diagnostic of anterior cruciate ligament tear. This should be measured at the lateral femoral condyle, not the medial one. As a reference, posterior tibial translation in PCL tear is measured at the medial femoral condyle. Due to the anterior tibial translocation, the posterior horn of the lateral meniscus is posteriorly displaced in relation to the posterior aspect of the lateral tibial plateau, which is called uncovering the posterior horn of the lateral meniscus. This patient also had a lateral meniscus tear and buckling of the patellar tendon. Anterior tibial translocation can be well assessed on the sagittal image, but it can also be predicted sufficiently on the coronal image. The lateral collateral ligament has an oblique course, so it may not be entirely visible on a single coronal image. However, with anterior tibial translocation, the tibia translates anteriorly, and the entire LCL becomes visible on the single coronal image, which is called the whole LCL sign. The specific name of this sign is not essential to know. In addition to the LCL, the popliteus tendon, PCL, and biceps femoris also show a vertical orientation. Thank you for watching this video. If you found it helpful, please hit the like button.